The price of perfection in healthcare. From the moment we are born, our bodies enter a system designed to protect, monitor, and manage life. Healthcare presents itself as a promise to safeguard well being, prevent harm, and guide individuals toward optimal health. From hearing a baby's first heartbeat during an ultrasound to newborn visits, human life begins under the watchful eye of medicine, framed by hope, care, and the expectation of safety. Yet the pursuit of perfection in healthcare can produce unintended consequences that are frequently overlooked. Systems intended to protect can instead prioritize ideals over individual needs, amplify stress, and expose inequities, particularly for marginalized populations. Across reproduction, mental health, and technology, the costs of this ideal emerge as both subtle pressures and life-threatening dystopian consequences. Bodies under surveillance, reproduction, and clinical care. Childbirth demonstrates both the promise and peril of healthcare's perfectionist ideals. Ideally, pregnancy monitoring aims to protect and support both mother and child, but in practice, the system often prioritizes institutional standards of success over the needs of individual patients. Marginalized women, particularly Black and Indigenous women, are disproportionately labeled as high risk or non-compliant, where their voices and concerns are far too often dismissed. The case of Portia Numenzi, a 35-year-old mother in Texas, illustrates the deadly consequences of this approach. After a miscarriage in 2023, Numenzi experienced heavy bleeding. However, doctors hesitated to perform a standard life-saving procedure, a dilation and curettage, also known as a D&C, due to the state's restrictive abortion laws. According to ProPublica, multiple OBGYNs later confirmed that timely intervention could have prevented her death. Compounding the issue, rural hospital closures in Texas and other states leave many pregnant women without access to skilled providers during emergencies. This case highlights how enforcing perfect outcomes can worsen disparities and dehumanize patients. Dystopian literature mirrors these real-world dynamics. In Marge Piercy's Women on the Edge of Time, Connie's reproductive autonomy is repeatedly violated. After an assault by the father of her child, she seeks an abortion, only to face institutional constraints. Later, she undergoes a hysterectomy while under psychiatric care, permanently removing her ability to control her fertility. However, Connie asserts, I will choose what enters me, what becomes of my flesh, without choice, no politics, no ethics. I am not your cornfield, not your uranium mine, not your cow for fattening, not your cow for milking. You may not use me as your factory. Priests and legislators do not hold shares in my womb or my mind. This is my body. If I give it to you, I want it back. My life is a non-negotiable demand. Her words deeply emphasize that choice is fundamental to dignity and ethics, both in fiction and reality. Attempts to achieve perfect reproductive outcomes through legal, institutional, or social pressures can produce surveillance, coercion, and preventable harm. Minds under pressure, mental health, and societal norms. The pursuit of perfection in healthcare extends beyond the body to the mind, shaping how mental health is understood, treated, and managed. Modern ideals of psychological well-being often equate health with productivity, emotional stability, and compliance. Normal human emotions, such as grief, stress, or fatigue, are increasingly pathologized as deficiencies. In children, behavioral differences are sometimes medicalized, and medication is used as a quick fix rather than providing holistic support. Similarly, burnout among nurses, medical students, residents, and other healthcare professionals is frequently treated as a personal failing rather than a symptom of systemic issues. Real-world examples highlight the dangers of over-medicalization. ADHD is often overdiagnosed in children, influenced by societal and educational pressures, treating normal behavioral variation as a disorder. Relying on medication as a corrective measure can pathologize healthy behavior, limit autonomy, and expose children to unnecessary side effects. Healthcare professionals face similar pressures. Studies on physician burnout reveal that perfectionist expectations, being endlessly competent, emotionally resilient, and always available, contribute to anxiety, depression, and chronic stress. In some cases, overmedicalization manifests as coercive interventions aimed at maintaining productivity, placing individuals in situations where treatment is imposed rather than chosen. These patterns expose a systemic problem when healthcare prioritizes conformity and idealized performance over personalized care. Treatment can shift from support to control. Overmedicalization labels normal human variation as pathological and can enable coercion, abuse, and marginalization. Marge Piercy's Women on the Edge of Time illustrates this vividly through Connie's treatment and the coercive nature of institutional psychiatry. As she is routinely medicated with drugs like thorazine to dull her emotions and enforce compliance, the institution's pursuit of stability reveals how treatment becomes a mechanism of control rather than genuine care. The novel continues to show how mental health systems can shift from supporting patients to policing them, shaping their thoughts and behaviors to match imposed societal norms. Connie's experience escalates when she is enrolled without consent in an experimental procedure called neurological behavioral modification. Doctors implant electrodes in her brain under the guise of scientific innovation, insisting the treatment will correct her behavior and produce a more compliant patient. Although framed as progress, the procedure is profoundly dehumanizing. Connie comes to understand she is being used as a test subject within a system that equates mental health with obedience. Her resistance is dismissed as further proof of her instability, creating a cycle where any attempt to assert autonomy justifies harsher intervention. Together, these examples demonstrate how mental health care can shift from healing to enforcement, echoing real-world concerns over medication, pathologizing normal emotional responses, and prioritizing conformity over patient well-being. Technology and myth of neutrality. Healthcare often claims neutrality that is scientific, fair, and objective, but this promise obscures the structural inequities embedded within the system. Historically, marginalized communities not only face medical bias, but also economic barriers that limit access to quality care in the first place. For many Black, Indigenous, undocumented, disabled, or low income patients, the problem is not just how they are treated once inside the system, but whether they can even afford it at all. From even once inside the system, implicit bias still continues to influence diagnosis, treatment, and the level of importance providers assign towards a patient. One well-documented example from CNN is the case of Dr. Susan Moore, a Black physician who was hospitalized with COVID-19 in 2020. Despite being a medical professional herself and clearly describing her symptoms, she repeatedly reported that her pain was dismissed. Her concerns were minimized and clinicians questioned her credibility. She later died and her case drew national attention as to how racism persists even in clinical settings that claim to be objective. Bias is not only interpersonal, as it shows in the same technology, as it shows up in the same technology that was intended to be neutral. According to a report by Science, health risk algorithms begin being commonly used by many hospitals have been shown to systematically underestimate the medical needs of Black patients by using historically biased cost data as a proxy for health status. As a result, healthier white patients are sometimes allocated more resources than sicker Black patients simply because of how the algorithm was designed. Therefore, the rise of digital health technology adds another layer to this tension. Telehealth, fitness trackers, health apps, and AI diagnostic tools all promise personalized insights and continue optimization. But for many people, this constant tracking produces a new pressure to perform health correctly, to hit step goals, perfect sleep cycles, maintain stable heart rates, or follow algorithm generated routines. This is when the pursuit of perfection begins to shift from institutions to individuals, turning daily health into a monitoring project. Furthermore, these tools are often trained on limited data sets that skew toward white, healthy, or affluent populations, which can lead to misreadings, misclassifications, and guidance that fails to reflect diverse users, unintentionally reinforcing existing disparities. Far from neutral, technology can widen the very gaps it claims to narrow. Additionally, this pervasive monitoring mirrors the control used in George Orwell's 1984, where telescreens constantly observe and evaluate citizens to enforce conformity. What appears to be empowerment can become surveillance. What looks like scientific neutrality can become yet another system that privileges some bodies while policing others. And what seems like guidance can actually produce stress, anxiety, and diminish autonomy. So, to reclaim imperfection and autonomy across reproductive care, mental health, clinical practice, and technological surveillance, a clear system, a clear pattern emerges. The pursuit of perfection in healthcare often leads to the very harms the system claims to eliminate. When medicine prioritizes ideal outcomes over lived experiences, it risks transforming care into control, silencing patients, ignoring context, and reinforcing long-standing inequities, whether through restrictive reproductive laws, coercive psychiatric interventions, or biased technological systems. The drive for perfection narrows the definition of health and devalues those who fall outside its boundaries. A more ethical and humane healthcare system acknowledges that imperfection is not a flaw, but an inherent part of being human. True care is grounded in listening, shared decision making, and trust, values that safeguard autonomy rather than erode it. By embracing complexity instead of chasing unattainable ideals, healthcare can evolve into a practice that protects without policing, supports without surveilling, and heals without harming. Reimagining healthcare in this way requires humility and acceptance that progress does not come from enforcing uniformity, but from honoring difference, vulnerability, and humanity. When we and when we center equity, compassion, and autonomy, we move closer to a system where the promise of care aligns with its reality. Only then can healthcare fulfill its promise, not by perfecting bodies or behaviors, by but by empowering the people who live within them.